When one has a labral repair surgery and we think about what are the risks of surgery, it is a low-risk surgery. The biggest risk of labral repair surgery is actually having a recurrent injury. And you think about it, your normal shoulder that had no damage to it was injured in the first place. And so when we repair your shoulder, it's not like we're making a stronger shoulder than the one that you were born with. So we repair it, we rehab you well, but certainly patients that go back to the exact same sport that might have injured the shoulder in the first place certainly are at a risk. Now, hopefully you go back wiser, you've worked on your form, you've realized any weaknesses that might have led to the injury in the first place. But what we see is the younger you are and the more active you are, the higher the level of sport, the higher the risk that you could re-injure your shoulder. That being said, the risk of re-injuring your shoulder without fixing your labrum is substantially higher than the risk of a re-injury if we fix your labrum. So if we think that you should have your labrum fixed so that you can continue sports, I still think it's the best route to take, but we have to have a healthy respect that there is a risk of recurrence. The one good side effect of aging, the older you are, the lower the risk of recurrence. So I think our older athletes have that in their favor.